How does bleomycin damage the lungs? Bleomycin is an antineoplastic agent widely used in the treatment of various cancers, including lymphomas and germ cell tumors. Bleomycin is known for its potential to cause pulmonary toxicity, which is damage to lung tissue. The exact mechanism of bleomycin-induced pulmonary toxicity is complex and not fully understood, but it involves the generation of reactive oxygen species, ROS, and subsequent inflammation. How does bleomycin damage the lungs? Bleomycin is a glycopeptide antibiotic that acts by binding to DNA and inducing strand breaks. During this process, bleomycin generates reactive oxygen species, including superoxide anions and hydroxyl radicals. Excessive reactive oxygen species production can lead to oxidative stress, causing damage to cellular structures, including lipids, proteins, and DNA. The generation of reactive oxygen species triggers an inflammatory response in the lungs. Inflammation involves the recruitment of immune cells, including neutrophils, to the site of injury. While neutrophils play a crucial role in defending against infections, their excessive accumulation can contribute to tissue damage. Neutrophils are phagocytic cells that release enzymes and toxic substances to eliminate pathogens. However, in the context of bleomycin-induced pulmonary toxicity, the excess presence of neutrophils can lead to the release of damaging chemicals, leading to neutrophil-mediated lung damage. These chemicals include proteases and reactive oxygen species. Now, regarding the connection with Neupogen, filgrastim, Neupogen and neutrophil increase. Neupogen is a medication that stimulates the production of neutrophils, a type of white blood cell, in the bone marrow. It is commonly used to counteract neutropenia, a condition characterized by low neutrophil counts. While Neupogen is beneficial in some contexts, its use in combination with bleomycin can pose risks. Exacerbation of pulmonary toxicity. Studies have shown that an increased number of neutrophils in the lungs, as induced by Neupogen, can exacerbate bleomycin-induced pulmonary toxicity. The heightened presence of neutrophils in the lung tissue may amplify the inflammatory response, contributing to additional lung damage. How does bleomycin damage the lungs? In summary, the combination of Neupogen and bleomycin may enhance the risk of pulmonary toxicity by promoting an excessive inflammatory response in the lungs. This underscores the importance of careful monitoring and risk assessment when using these medications in combination, especially in patients with pre-existing lung conditions or susceptibility to pulmonary complications.